Dear Dr. Tony, I am the mother of a 7-year-old son with AS. He is academically very bright, but clearly lacks social skills. I have 2 questions about him. The first is, how do I motivate him to complete his work? Even though that I know he is capable, he doesn't seem to have the need to please, and he keeps putting off his schoolwork. The second question is there a way I can improve his focus? He can focus on topics in his interest over long periods, but not on things that he's not interested in. And this is from Celestia at Autism Hangout.
Okay, this is a common one, really. Yes, he's very bright, but very dedicated to what he's particularly interested in. And he'll probably describe the other activities at school as boring. People with Asperger's are very black and white. They either like it or they don't like it. Typical kids, if they don't like it, no, pass marks 40%, I'll just get 41%, just get over the line, then I'm there. But those with Asperger's say, I don't like it, don't want to do it, what's the use of it? I'm not going to waste my time on it because I've got far more interesting things to do that he pursues. It's a tricky one. He's only 7 years old. It really requires, if you can, to get the teacher to weave into the task aspects of his special interest. Sometimes what we do is the kid doesn't like the social side, which is where the teacher presents in a social theatre of the classroom. But sometimes they can learn by reading a textbook or CD-ROM computer. So sometimes you can take away the classroom social teasing repartee environment and he sits in a corner of the library and reads about it and then presents to the class on his knowledge as an expert. So he becomes a teacher, and in many ways he'll see himself more as a teacher. Now, how can I improve his focus? I just run last night a teenager group for teenagers between the age of about 13 and 17. Major focus was on how to improve attention span and so on. It's a tricky one. I tell you what, can I take a pause for a moment and collect the words of wisdom from the teenagers with Asperger's that we talked about this? So, Craig, if you can hold a second.
Okay.
I'll see if I can get those notes. Okay, no, I've just checked my notes. Unfortunately, my colleague Emma is timing them up, but next time we'll have that list for those with Asperger's themselves. We're trying to improve focus. People will think, yes, should they have medication, Ritalin, dexamphetamine and so on? Yeah, it may help, but a lot of the guys don't like taking it for a variety of reasons. You've got to remember that they're needing short breaks in between doing the focus and activity. It really is trying to improve their concentration by the importance of what they're doing. And recognizing that every so often they're going to drift off in their imagination or distraction. So you clear the decks, you make sure that they're really going to focus on what's to hand, and that they may be near kids who can prompt them to get them back onto work. But I'd really like to focus on this in more depth next time.
Okay, excellent. And I'm sure the people will wait for your wisdom.
Yeah.
The next 3 questions have to do with sensory issues. Our son becomes quite agitated and aggressive even when someone around him either clears their throat or begins coughing. He tends to physically lash out at that person, and we've been unable to receive any clues as to how we can help him cope with this problem. This is from Autism Hangout, Lynn Bentley.
Interesting. I wonder if that's the Lynn Bentley I knew years ago with her son Troy. I'm not sure how many Lynn Bentleys there are. If it is, I remember Troy when he was about 4 years old, and it's a problem that he's had for a long time. Difficulty here is that this is a very painful experience for him that is not only painful, but he's desperate to stop it and prevent other people from doing that noise again. I mean, you almost feel like you want the person to have a sort of T-shirt with clear words on it. Please do not cough or clear your throat because this is excruciatingly painful for me and I hate it. So you almost need that, or a button or something, so that people can recognize that. It's difficult because the person is so impulsive. They have the pain. I've got to stop it. Please stop that. It's horrible. And it's trying to get them to communicate that. Now, it depends on how verbally fluent the person is to learn a set phrase, and that's almost like creating, in a Carol Gray sense, a spoken brief social story to explain it. Obviously, parents try and avoid situations like that, but somebody's going to do that, they're going to clear their throat. But it needs to be that he's got something to say very quickly that may be more effective in stopping him. So he needs to communicate that I don't like it, rather than invert words if he can, or a symbol or card that he shows them that that's his problem, rather than reacting by hitting them. The thing is, with this, punishment rarely works. It's unlikely to prevent him doing it because it's fairly spontaneous. It's really, Lynn, a major problem. And if it is Lynn Bentley, then give us a call.
Okay, excellent. Another sensory issue. I hate high-pitched sounds, and when it comes to high-pitched laughter, among other noises, I cringe like a scared child. It's been bothering me since, most likely since birth. Have you, Dr. Tony, looked into laughter as a sensory issue for those with Asperger's? And if you have, do you have any ideas as to how I could desensitize a sensory problem? This is from Carlander Cinema at Autism Hangout.
Oh, there's a lot in that question, actually. First of all, it can be an issue of the laughter, either a particular person's laughter or a particular pitch, etc., that is a sensory sensitivity. But there can also be a psychological sensitivity in terms of a history of being laughed at. And I have to explain in social stories to people with Asperger's that there are many different types of laughter, and they can be laughing with you, at the situation, at the absurdity of it, but it's not necessarily ridicule. So there's often a psychological element too. Now, the suggestion could be to desensitize. That is gradual exposure to the laughing, and you eventually have the ability to tolerate it. In general, in Asperger's, this tends not to work because the person doesn't what we call habituate. They continually have a startle reaction to what's going on. Sometimes the best way is a barrier. So when people laugh, is to cover your ears as the best way you can. Or people will say, could hypnosis work? Or it's a possibility. I mean, you may try. Oh dear, I really feel for this person. I can't give a simple answer other than to create a barrier of earplugs or those sort of situations. As soon as you see somebody that may be laughing or a laughing situation, to do that, but then explain to them that I have a special hearing quality that makes that a little bit like people don't like fingernails down a blackboard, and use that analogy. It's like fingernails down the blackboard. It's a sound that for me is absolutely excruciating, and say other people have probably got that too, but it really is upsetting. So that's what I can suggest to that particular person.
Very good. Here's the last of the sensory questions. What is the deal with some Aspergians and salads? My grandson is afraid of salads and will not sit next to somebody that's eating it. Eggs seem to have the same effect. Is this normal for them? I read someplace where this follows suit with some Asperger's children. He won't touch fruits, salads, or vegetables. This is Swoon at Autism Hangout.
Well, welcome to Autism and Asperger's. Your grandson is experiencing, again, the sensory inequalities. Now, when you look at salad, salad is not only... What makes a good salad is the mixture of flavors and colors and textures, and those with ASD want either something sort of fairly bland or consistent. They don't like sandwiches with lots of different things in them. So when you've got a salad with so many things, it's an explosion of taste, but also color, texture, etc. Neurotypicals find this absolutely delightful, but for those with Asperger's, yuck, it's far too much and overwhelming. The same can be for vegetables, etc. It can be some aspects of texture, it can be taste, it can be color, it can be so many components too. I mean, what you can do is encourage the child as much as they can to be brave in trying various things. I wouldn't force the child because it's a sensory, painful issue, but it's not simply going to be overcome by forcing them to do that. And so sometimes you have to accept there are certain things that they won't like. As time goes by, you may get them to add another little bit of extra piece of lettuce leaf or something like that. But the important thing to remember is this is a painful experience in a sensory sense. And so the person needs understanding and encouragement rather than, well, why can't you eat it?
That's right, rather than the challenge. Next question is from Pagan Warrior. Pagan says, I am an adult with a diagnosis of Asperger's syndrome and ADHD tendencies. Due to reasons beyond my control, my support providers have changed at the beginning of February. The thought of a major disruption in the structure of daily life stresses me. For those who are going through similar situations of stress, what would you advise?
Oh, one of the major causes of distress for those with ASD is change. But especially change in people. Neurotypicals have the ability to have a sort of a schema or understanding of different types of people and read their body language and gestures fairly easily. For a person with Asperger's, each new person is like a new species. They have their own facial expressions, they have their own style, they have their own mannerisms. And for typical people, they're very flexible in accommodating to the style and character of people. Now, what it means is that when they have new people, they've got a whole new personality, a whole new structure, a whole new atmosphere. It is so stressful for them that we try and minimize as much change as possible. Now, it's also important that when the new people come in, how good are they at understanding the person with ASD? Not everyone can do that. It's a two-way process, and the person with Asperger's or autism has their own body language, style, etc., their own mannerisms, their tone of voice. Those who know them well can read their body language, their subtle movements, and know what mood they're in. So there's going to be a breakdown in communication right from the beginning. So no wonder it's incredibly stressful for this person. Now, what we can do here is recognize on both parties what's involved. Now, I sometimes ask those with Asperger's to create what I call a foreign phrase dictionary. In other words, when I speak in this tone of voice, my eyes go this way. When I have that mannerism, this is what I'm thinking and feeling. But you may not know that until you've known me for several months. Sometimes working with a parent or the last care workers that are with you, ask them to write down, how do you read me? How do you know my moods? How do you know what I'm thinking and feeling? And that must be passed on to the next person. There must be a handover, not just by words, but by a document that allows that person to say, when you start talking about this, this really means that you're worried about whatever. When you look at me from that slightly changed facial expression, I read that as sadness, but in fact, you're just okay. So that information needs to be passed on.
Okay, why don't you take another sip of tea, and I will read the next question.
Thank you.